I'm Dr. Jonathan Lee from Englewood Orthopedic Associates. I'm one of the 2 spine surgeons on staff. I always knew I wanted to be a surgeon while I was in med school. I think there's just something about being hands-on, fixing problems directly, and especially in spine, if there's an area where there's a nerve getting pressed on or some sort of mechanical block, removing that usually takes away their pain. Some of the things I treat are mostly cervical and lumbar degenerative conditions, whether that's degenerative disc disease. A lot of times patients just have sort of arthritis in their necks or backs, herniated disc issues. A lot of times they have instability in their spine, so we have to then opt for fusions. With spine problems, we have patients who maybe they just twisted their back over the weekend, or they've been dealing with pain for a few months or a couple years, and they've just never had any formal treatment. So, getting to see them and examining them and hearing their story really allows me to kind of, build a full picture of sort of what's going on. It's like problem solving, a puzzle. On a daily basis with every patient, I always feel like I'm learning something new. They're all different ages, they're different cultures and backgrounds. They have different types of professions. It's always interesting to see how their condition sort of impacts that daily life. Everyone thinks when they're seeing an orthopedic surgeon, that means they need to have surgery or being signed up for surgery even on their first appointment, but that's not actually the case. So we always like to start easy, simple, least invasive. And usually that's physiotherapy and some sort of either anti-inflammatories or other types of medications that usually we can get patients back on their feet pretty quickly. We always counsel our patients that the goals for our surgery a lot of times are, as you would expect, to sort of improve their symptoms, right? So whether that's pain shooting down the leg, numbness and tingling, and with a lot of our surgeries where we are removing things that are pressing on the nerves, after surgery they have immediate relief with those things. So I grew up in Jersey. I've been here most of my life. I went to medical school and residency down the road. So it's really great to be back in this area, and I couldn't imagine being anywhere else.